Hey guys, this is Dr. John. I'm sitting in front of the whiteboard in my office where I write research articles with research findings, angular numbers, biomechanics, things that help me describe what I do for the spine and why you might want to do those things. I came across a study, it's from 2017, and it's in the Journal of Neurosurgery Spine. And what it says, I'm just going to read it, the title says, Spinopelvic sagittal imbalance as risk factor for adjacent segment disease after single segment posterior lumbar interbody fusion. And in this study, what they did was they went back and retrospectively looked at people that had lumbar body fusions where they took the segments and they fused them together. And they looked at the spine-shaped characteristics that led to degeneration of the adjacent segments, adjacent segment degeneration, right? And what they found is that people, if we look on my spine here, that have big deviations in sagittal alignment from front to back, or if they had alterations in lumbar lordosis, or if they had alterations in pelvic incidence, which is an angle of the base of the spine and how it relates to the lumbar spine and actually where the leg bones are. If they had those things, they were significantly more likely to have adjacent segment degeneration after they had surgical fusion of these joints. So the takeaway is you don't have to wait until you have a surgery in that area and have it artificially fused. We see lack of motion and change in people's lumbar spine every day. And the main conclusion that I thought was very profound, because that type of language is not necessarily used very readily in a journal, is that achievement of appropriate lumbar lordosis and pelvic incidence prevents adjacent segment disease after fusion. So this journal is actually saying that getting your spine in a healthier configuration actually prevents degenerative changes in the spine around those areas that are stuck. This is directly applicable to chiropractic, directly applicable to everybody's life, because when I look at people's spines, some spines move better than others in some areas. Some are worn out in areas other than what's expected. Some areas are worn out in areas that are expected. And this is a great example of getting your spine in a better shape as something that can prevent further disease and dysfunction along the line. Thank you. Have a great weekend.